Don't do a birth plan. Nurses hate birth plans. By the way, you have no control over the farting. It is just going to happen because they've been seeing them all throughout the pregnancy. This one surprises a lot of people. Fires out like a champagne toast. How you're going to go into labor, or when you're going to go into labor, or how your labor is going to go. Easy peasy, lemon squeezy. Let's get into the 10 things I need you to know as a labor and delivery nurse. Let's jump right in with the first thing I need you to know, and that is you don't need to apologize. Come here. You don't need to apologize. And this happens all the time. Someone will be pushing a baby out and they'll poop a little bit and, oh, I'm so sorry. Or somebody might be experiencing something that hurts a lot and they drop an F-bomb and then it's usually followed up by, oh, I'm so sorry. Or someone will fart. And by the way, you have no control over the farting. It is just going to happen. But then immediately comes the I'm sorry. And I'm here to tell you that you have nothing to be sorry about. You are having a baby, and the things that you are feeling and seeing and experiencing, those are all valid things to be seeing and feeling and experiencing. And even if you've had a baby before, this birth, I can guarantee you, will be completely different because no two births are the same. So if you are doing things and you are feeling the need to say sorry, just remember, hey, this is my experience. They have seen it all, and I don't need to say sorry. And also, if you're gonna drop an F-bomb, but you feel like it's a terrible thing, let's drop one together right now so you can get it out of the way. You don't feel like you have to say sorry. You can say sorry now, but when you're giving birth and you drop an F-bomb, no more I'm sorry's, okay? Are you ready? 1, 2, 3. There you go. We got it out of the way. So you don't need to say I'm sorry. Next thing you need to know is that it is not a beauty contest. If you come in to have your baby and your legs are not shaved, or your toenails are not perfectly manicured, or your is not trimmed into a perfect do, girl, me neither, and I am not 9 months pregnant. I will tell you this from experience. People come in to have babies all the time, and a lot of times it is unpredictable, and a lot of times they are not fully put together from head to toe. But you know what? They still have a baby, and they still love their baby no less than if you came in and you had just gone to the salon. So it is definitely not a beauty contest, but I mean, I have seen my fair share of really, really cute decals on people's toes because my name is Tina, and I am a labor and delivery nurse. I am a certified perinatal nurse and a certified breastfeeding specialist. If you are new here, welcome, welcome, welcome. And if it is not your first manicured rodeo, then welcome back. We're gonna get right back into the next thing on the list that you need to know from your labor and delivery nurse. Your provider, the one who's been caring for you throughout the pregnancy, might not actually be the one to help you deliver your baby. And this one surprises a lot of people. I think a lot of times people see in Hollywood TV and movies that it's always the doctor there having their baby and they're talking to them like they know them because they've been seeing them all throughout the pregnancy. However, there are some providers who are in a group of providers. And so whatever day you come in to deliver your baby, it could be whatever provider is on for that group that actually comes and delivers your baby, even though you may have never met them in your prenatal appointments before. So I like people to be aware of that because it can be surprising. But what does that mean for your birth wishes? What does that mean for all of the things that you've been discussing with that provider at your prenatal appointments? Are they just out the window, or do they still come into play? And the answer is they still come into play. And we're going to make sure that happens in a few different ways. One is create yourself a birth wish list and then bring that birth wish list in with you. Bring a couple of copies. One can be in the room, one can be in your chart. We could even put one on the door. And that way, whatever team members are there with you when you are having your baby and whatever provider happens to be there at the end to catch your baby, then everybody can be on the same page with what you have been discussing with the provider that's been in charge of your care throughout the pregnancy. And the other way that I suggest this gets done is to have a support person with you who's a little bit of a stronger voice, maybe, that they are in tune with what you are expecting out of your birth experience and your wants and your wishes, and they are not afraid to vocalize those wants and wishes and really help them carry out those wishes the way that you plan them out. And speaking of birth wish list, the next thing I want you to know is that we love a birth plan. You might have heard from some people that birth plans are poo-poo. Don't do a birth plan. You can't plan your birth. Don't do any of that work. I love a birth plan, and a lot of labor and delivery nurses love a birth plan. And that is not to say that because you hand me a piece of paper with your birth plan or your birth wishes on it, that I'm going to say, yes, this is exactly how this is going to go, because we know that birth is one of the least plannable events on the entire planet, right? However, when you hand me a birth plan, I can take a look at it and I can tell right away that you have really looked into the things that you are wanting for your birth experience. You've done a lot of research, you've done a lot of reading, maybe you've taken a prenatal course, you've done a lot of planning. It really tells me that you are invested in this experience and that there are things that are important to you. And then I can do my best to make sure that those things that are important to you can happen as long as it is possible that they can happen. So if you hear people say, don't do a birth plan, nurses hate birth plans, that ain't true. I love a birth plan, so bring it to me. Look at us go. We're already halfway through the list. The fifth thing I want you to know as your labor and delivery nurse is that car seats are for the car. And that sounds a little bit weird. Let me explain what I mean. Yes, you need a car seat to bring your baby home from the hospital. And that car seat, it needs to be an infant car seat. It's going to be rear facing. It is going to have a 5-point harness safety system. And it also needs to be certified in the country that you live in. And it needs to not be expired. And yes, car seats do expire. So if you are using them for multiple babies, make sure that you check that expiry date on the seat itself. But a lot of parents, especially first-time parents, when you come up and you think that you're in labor and we haven't even seen you yet, we don't know what's going on, they will come up lugging that car seat up the stairs, huffing and puffing. And I'm here to tell you, you will have a lot of time from the time you come in to be seen, and yes, you're in labor, and then you get into a labor room, and then you go through labor, and then you have your baby. It's a bit of a long process. It's a bit of a marathon. You will have a lot of time in there to collect the car seat to bring your baby home. And the reason I say that car seats are for the car is that you actually don't even need that car seat until those moments that you are discharged from the hospital or the birthing center and you are ready to go home. So you can actually leave the car seat in the car until those last moments. Next thing to know about is that the pain of childbirth doesn't magically stop once your baby is born. And this one surprises a lot of people. And let me explain before you get too panicked. Yes, those huge pains of childbirth that come with those big contractions to birth your baby, those are going to stop once you are holding baby in your arms. However, it is not going to be a pain-free journey from there on out, because once you have your baby, you then have to birth your placenta. And that placenta, of course, was attached to the wall of your uterus. And then your uterus has a job of two things. First, it is going to try to shrink itself back down to its pre-pregnancy size. Now, that's not going to happen right now. It's going to happen over around the next 6 weeks, but it's going to start that process of trying to shrink back down. But it is also trying to control the bleeding from that wound that was left when the placenta came off of the wall of the uterus. So it is still going to be doing those contractions. And these smaller contractions, for those reasons I just talked about, they're known as after pains. And these after pains, they might be a little bit more intense the more babies you have had. I will tell you the after pains I had with my fourth baby were they were not enjoyable at all. And they are likely also going to be worse as you are breastfeeding, because when baby is suckling at the breast, that's going to cause that release of oxytocin, which is going to cause those little mini cramping contractions in the uterus. But I want people to be aware, because I think a lot of people, from TV and movies, thanks again, Hollywood, they think, yep, baby comes out and then it is just easy peasy, lemon squeezy, no more pain. But that is not actually the case. I also want you to know that skin to skin with your baby after they're born, that is absolutely the goal. And it's a phenomenal goal to aim for. You're looking for a minimum of 60 minutes of uninterrupted, that's a key term, very important, uninterrupted skin-to-skin time with your baby after they are born. That is their naked body on your naked body. That's known as the golden hour. Now, there are some situations, maybe you're not stable or baby is not stable or you are not feeling well, where skin-to-skin with you and baby, it may not be accessible. And in this case, it is still beneficial to be skin-to-skin with someone else. So this can be your support person or your partner or a family member, someone you're comfortable with. It's going to still show them those benefits. And as soon as we are able to get baby skin-to-skin with you, do, we will absolutely make that shift and move baby onto your chest. Now those benefits, there are lots of them for you. If you're having those after pains we just talked about, it's going to help sort of minimize those sensations because it will decrease your pain a little bit. It'll also cause you to feel more relaxed. It's going to include that bonding time with baby. It's also going to help with postpartum bleeding because it helps you to release that oxytocin, which helps that uterus to kind of clamp and contract down, which is exactly what we need it to do. And it's also going to help you initiate early breastfeeding and an early latch for baby if that's how you choose to feed your baby. But for baby, there are also a ton of benefits. It's going to help them to regulate themselves. It's going to help them to regulate their breathing rate and their heart rate and their temperature. It's also going to help them to stabilize their blood sugars, which is really important. It's going to help them with infection control. It's going to help them feel less stress, less pain if there's anything happening with them. But also it's going to help initiate that early breastfeeding on their end because they'll actually do something called the breast crawl. If you allow it to happen and it's going well, baby will actually move towards the breast over a period of time, and they can actually latch themselves because your areola, they have little Montgomery glands in them, and those Montgomery glands, they actually secrete something that smells like your amniotic fluid to draw your baby towards them to help facilitate that early breastfeeding. So the more you know. The next thing I want you to know is that losing your mucus plug does not necessarily mean you are going to go into labor. This one surprises a lot of people because we have been led to believe that the moment you lose that mucus plug, you are going to kick into labor, and then the next scene is you like holding your infant if your life was a movie. But for a lot of people, that is not actually how it goes. Can that mean that there are some small cervical changes happening? Absolutely. And if you are in later pregnancy, is losing your mucus plug a win? Yes, it's a win. You can put it on your win list. But I do want to let you know that it doesn't necessarily mean you need to be on baby watch from that moment on. Let's first talk about what the mucus plug is, because I think a lot of people think it's like a solid cork that sits in your vagina, and then when you're ready to have your baby, it fires out like a champagne toast, and that is not what it is at all. It's actually a layer of mucus that's up against the cervical opening. It forms in early pregnancy, and this has a protective mechanism for us. It actually sort of keeps the bacteria out of your baby's living room. So when you are going through these changes, usually in later pregnancy, maybe your cervix is dilating a little bit, maybe it's thinning a little bit, maybe it's softening a little bit. Those changes will sort of loosen up that mucus plug, and then you can actually pass it. And when you do pass it, or if you pass it, it's going to look sort of like really thick snot, and it might have like streaks of red or pink through it. That's from those cervical changes we talked about. But I do want to let you know also, a lot of people never lose their mucus plug. It sort of comes out during the labor process, and they never saw it. I would be in the camp never losing your mucus plug. So if you are before 37 weeks of pregnancy, you should absolutely let your provider know if you think you have lost your mucus plug, because you are still considered preterm. Your baby is still considered early, so they will want to know that in case losing that mucus plug is associated with bigger cervical changes and you going into labor. That's important. However, if you are after 37 weeks of pregnancy, you're towards the end of your pregnancy, and you think you lost your mucus plug, your provider may or may not want to know that, so you can chat with them in prenatal appointments. You don't have to rush into emergency unless there are other things that go along with it, like decreased baby movement or big strong contractions or your water breaks. Yes, then you want to come in. But if you just straightforward lose your mucus plug, you are after 37 weeks of pregnancy, you do not necessarily have to come into the hospital to get checked out, because it doesn't mean that labor is coming in the next hour. And also, if you lose your mucus plug, we don't need to see it. You don't need to bring it in. We believe you. We're almost through the list. The 9th thing I want you to know is that babies, they don't always follow the water slide if your water breaks before labor. And again, we have Hollywood movies to thank for yet another big blunder. This is almost at the top of the list, that as soon as your water breaks, you are going to kick into rip-roaring labor, and you are going to have your baby a couple of hours later.
My water broke! I'm having the baby!
And I'm going to tell you, for a lot of people, this is not the case. A lot of people, their water will break before their labor starts, and then they will wait, and nothing will happen even though that water is broken. And some people, they actually need to be induced to bring on labor even though their water broke. And this bag of water, of course, is what baby is floating around in. It's their protective bubble. So it is true that once your water has broken, a little bit of a time clock is going to start, because we have an increased risk of infection once that bag of water is broken. There's basically now a direct portal of access into the environment that your baby is in. However, even though a lot of providers are wanting you to go into labor within 24 hours, that's sort of standard what we see in labor and delivery units, to decrease that risk of infection after water has broken, that research, it is a little bit outdated. It's based in about the 50s and the 60s, so we do have more updated research that's telling us that you might have more around 48 to 72 hours after your water breaks before that rate of infection really starts to rise. However, like I said, very standardly, you are going to see that 24-hour rule in place to protect you and baby and have baby birthed before that risk of infection really starts to increase. There are some other numbers I want you to be aware of. Around 45 people will go into labor on their own within 12 hours of their water breaking, and around 75 to 77% of people will go into labor within 24 hours of their water breaking. But it is really important once your water does break to really pay attention to how you're feeling and how baby is moving. And then it also might be difficult to tell if your water broke. Sometimes you get the big Hollywood gush, but sometimes you just get a small trickle. So if you have the small trickle and you're really trying to figure out, did my water break or did I just pee my pants? Here's what you're gonna do. First, you are going to go pee, then you are going to put on a panty liner or a pad, and you're going to lay down for around 10 to 15 minutes, and then you are going to stand up. And if you have a big gush of fluid onto that pad or panty liner, well, your water is likely very broken because you went pee, you got the pee out of the way, you laid down, that fluid probably pooled in the vaginal canal, and then you stood up and out it came. So at that point, you're gonna wanna let your provider know or head in to get checked out. And the last thing I want you to know as a labor and delivery nurse is that a prenatal cervix is still just a prenatal cervix. Some providers will suggest a routine cervical exam at your prenatal appointment as you get later on in the pregnancy, 38 weeks, 39 weeks, 40 weeks. And if that's something that you're into and you want to know what your cervix is doing, then absolutely you can get that cervical exam to know what is happening. But I want you to know this. What your cervix is doing at your prenatal appointments is by no means a crystal ball. It is not going to tell you how you're going to go into labor or when you're going to go into labor or how your labor is going to go, because at that prenatal appointment, you could be like 2 centimeters and 40% effaced, and then you could stay 2 centimeters and 40% effaced for the next 2 weeks. You could be 5 centimeters and walk around like that for a week or two, or you could be closed at that prenatal appointment, no dilation at all, and then you could go into labor that evening. It really does not determine how or when you're going to go into labor. It's just what you are in that very moment as you are still pregnant and not in labor. However, if you are going to be induced, knowing what your cervix is doing is pretty important because it's going to tell you your Bishop score, which is going to tell you how ready your cervix is for labor, which is kind of going to help you decide which way you want to be induced, if you want to work on the cervix or if you want to work on the uterus. So in that case, it is a great idea to have a cervical exam while you are not in labor. But again, prenatal cervixes are not cervixes that are in labor. It is just giving you a snapshot of that moment in time. If you liked this video, go ahead and give it a thumbs up. Consider subscribing. I, of course, have something else that I'm sure you would be into because it is all evidence-based care on pregnancy and postpartum and breastfeeding and all of the goodies. So be happy, be healthy, be well. See you next time.